share our work that we've done. My wonderful staff has produced a protocol that we're going to follow, but more importantly, a guideline for us how to help people through the different stages of recovery. And which I think what we're going to get out of this discussion, it's a 20-minute discussion. So we're not going to cover all the topics, but what we're going to get from this is that it's a step process that comes out of experiencing COVID-19. So I'm going to share my screen with you now. Okay, so my name is James Fowler, and I'm a physical therapist. I'm an American College of Sports Medicine specialist, exercise specialist, and a certified ergonomic assessment specialist. I graduated from NYU in 1994, and 26 years later, I've been a physical therapist. And for 20 years, I've been running James Fowler Physical Therapy, and have a wonderful practice on the Union Square district in Manhattan. So I want to start this by, first of all, sending my good wishes to you all. I hope that you and your loved ones are well and maybe have not experienced the COVID-19. However, there's a very good chance that some of you, considering the frequency here in New York, that you have experienced some symptoms of COVID-19. Maybe you're in the process of it, maybe you've recovered from it, maybe somebody in your family is experiencing it right now. And so it's really important for us to start to understand that what we're going to try to talk about today is the process of recovery from a physical therapy standpoint, and looking at it from general categories of exercises. We're not going to be able to have time to go over specific exercises, but we can show you the step process that we're going to go through and over the protocols and the program that we put together. So when I get started with this idea, well, first of all, I do want to say that if you have specific questions and you are in the process of recovering and you want to know more about specific exercises, the best way to do that would be to contact us for a teletherapy session, or when our office opens up on June 15th, which will be COVID-19 ready and following all the protocols, we'll be able to start you with an initial evaluation. But if you have really specific questions and you really need help, we're here to serve you, and we'd love to put this program available to you. So to start, we need to understand that recovery from COVID-19 is a physical therapy perspective. So we have to understand that involves recovering from COVID-19 starts with the patients who are most affected. And these are the patients that have been hospitalized with severe symptoms. We're going to start there and build our recovery program from there. We are an outpatient practice, so we don't directly deal with those, and I haven't directly drilled with the hospital-based therapies, but there's a lot of great research, and it's very detailed in terms of how they go through this process in order for them to get to discharge. So we're going to discuss that. So before we start, I just want to make sure that we have a clear definition of COVID-19, which I'm sure that some of you have already read it a million times about what it is. But COVID-19 stands for CO, which is a coronavirus. And these type of viruses have been around on our planet for some time. And they're a large family of viruses that are common to people and many different species of animals. The coronavirus can affect people, and it's spread from a person-to-person contact. Such coronaviruses that are currently prior to the COVID-19 were the MERS and SARS that you probably have heard about. So the new virus, which is completely new to the human body, which is why this is so difficult to deal with, is the coronavirus or COVID-19. So I want to start by, well, first of all, let's review quick symptoms, and so that we're understanding the levels here. So the spread of COVID-19, as I said, is through respiratory droplets and through air transmission, or through the process of the virus being on a hard surface. As you know, the initial symptoms are fever, cough, shortness of breath, chest tightness, chest pain, muscle pain, sore throats, loss of taste and smell. There are others, but you know, these are the most common. The symptoms that are most severe, which sends a person into the hospital, are the loss of breath or the shortness of breath, cognitive changes where they become, there's a confusion, inability to know time and place and where they're located, and then an inability to stay awake, blue lips, blue face, which are all due to oxygen saturation levels that are decreasing, persistent chest pain, and paralysis, which they're finding is due to the possible blood clotting leading to strokes. So then why does this happen? And I'm going to just give you a brief description of it. Your immune system goes because this is a foreign virus. It's never seen it before. And your own immune system basically attacks the virus, but it attacks everything else. And this causes excessive inflammation in the body to our organs, our heart, our lungs, our digestive system. And it does affect our muscles and our musculoskeletal system. So what happens then is this acute inflammation starts to build up, and it fills into the lungs, where we now have an acute respiratory stress syndrome, or ARDS. This is a condition that's common, that can occur with people with, you know, respiratory disease. And this is what leads to the pneumonia, which develops the excessive, you know, fluid collection in your lungs. So now we're going to get into, so what happens if the patient is hospitalized? And that question really depends on the severity of your symptoms and the level of how much the COVID-19 is affecting you. So we're going to talk about the levels and get into that right now. So we have the ladder of recovery of patients hospitalized. And this is an image that, that I personally have about the idea of climbing out of a hole. And you need a ladder. Some people, unfortunately, go very deep, and they have a long way to climb out of it. And that process, there's the therapist she's an excellent therapist out there in the University of California, San Francisco. She's in the UCSF medical system. Her name is Heidi Engel, and she described this into these three phases. The underwater phase, which is patients seriously ill in the ICU. The post-critical, or really the critical care phase, where they're maybe still around ICU or in critical care, but they're starting to stabilize. And then she describes it as the marathon training phase, which I think is really interesting and is very, very apropos to the long process of training for a marathon. Well, when these people get out onto the medical floor and they're no longer in intensive care, it's a long process. And it's really a step-by-step process if anybody's experienced training for a marathon. So this underwater phase, patients are seriously ill. They go immediately on a ventilator. They may be on the ventilator for 1, 2, 3, 4 weeks. I actually just heard a story where a patient was on a ventilator for 40 days. And they're usually lying in a prone position to help assist their breathing. They have minimal or no physical therapy at this time, but they will have occupational therapy for some cognitive, you know, keeping their cognitive sense of presence intact. They are heavily sedated, and they have a series of deliriums where they start hallucinating and having delirium type experiences. And obviously they start, once the days go by, they start losing muscle and lose loss of function. But they do come out of this. And the hospitals here have learned, you know, as each weeks go by, better and better how to address this. And more patients are either not even getting to this phase, or they know how to get them out of it in a quicker state. So, but now we have the next phase. They're in the ICU, but now they can do more. So we call this the critical care phase. And they're still on the ventilator. So they're having assisted air breath machine. But we can initiate the physical therapy. But they have to be monitored very, very closely. So they have a team of people in there monitoring everything that would indicate a digression in their progress. So in this state, they're starting active range of motion, they're starting muscular strengthening, they're starting with what we call isometric holds. In my world, isometric holds is like hold and relax, hold and relax. And what Dr. Engel was saying that was interesting is that they try as hard as they can to work them to develop muscles. Now, they're at this point maybe just sitting on the edge of the bed and just standing, but they want to build muscle mass. And he made a critical point here is like, this is not the time for really respiratory therapy. They're just trying to sync their breath with the ventilator. So really what they can do is develop strength. And that's this critical care phase. Now, again, let's say we've progressed out of this phase and they're left this stage and now they're gone to the floor. And there we have the marathon training phase. And the way she describes that is they're off the ventilator, but they're on a lot of oxygen. They're short of breath. They have, she's correct that. They're off the ventilator. They still maybe have some respiratory issues with breathing, but they're able to sustain it with the oxygen. They're walking in the hospital with an assisted device, hopefully out of the room. They're continuing with a strengthening program, progressing with that program, and their level of function is starting to increase. It goes from bed mobilities, transfers, sit, stand. These are the type of things that they do in bedside physical therapy. So here we are. They're at that phase, and it's a long process. They could be in the hospital up to 30 days, sometimes longer. And this could be hopefully maybe 2-3 weeks of this process to get them back so that, as she put it at the University of California in San Francisco, is that and I don't know if this is true with all the hospitals, but I'm pretty sure it is their goal. They try to discharge their patients so they're fully functional. And that's really interesting when you consider that some patients who go in maybe live alone, and now they're going back into a situation where they have to begin to care for themselves. So one of the requirements for discharge would be walking with or without assisted device. They're not experiencing shortness of breath. They're not on oxygen. They're on a full diet. They have maybe slight cognitive issues. Maybe they're, kind of slow in thought and difficult to concentrate, but they know their time, their place. They've been discharged with the home exercise program, and they're also been discharged with proper home equipment, which is really important. Maybe a tub bench or, bars for the shower. Maybe some assisted devices that need in the kitchen to deal with opening jars and things of that such. Okay, so now they're discharged. And what they're finding now, which is interesting, and this was actually interesting to me because I had my own experiences, and now they're finding that they're doing studies up at Yale University collecting data about patients who have been readmitted. And they're finding that the patients who have been discharged and begin to start a progressive, but gradual but progressive program where they're walking in the house and then starting to walk out, where they start to walk and they get to about 4,000 steps. Now, 4,000 steps is about a mile of walking or, maybe 40 minutes of walking at a slow pace. And that's the starting point. Some patients might be starting less, but they're finding that the patients that start to move do better. Now, the patients that maybe they're below 2,000 steps. So maybe they're only up on their feet 20 minutes, 30 minutes of the day. The rest of the time they're sitting, waiting for this disease to go away, waiting for their body to get better. They're finding that those individuals are have a very, and the percentage was amazing to me, but he said 250% higher chance of readmission. So I'm not sure exactly how that number really works out, but let's just say there's a high incidence of these patients going back into the hospitals. So theme here is movement, exercise, gradual progression is very important to the recovery and to your own health and the fighting of the COVID-19 in terms of preventing, any further complications. So I do want to make one point here. The patients that get admitted, not all of them go on the ventilators. Some of them go directly into kind of a critical care, but on oxygen. And they're actually finding that a lot of the people, they're finding not to try to get them on the ventilator, so they're just giving high levels of O2, and that's working. Well, that's a godsend, because then the ventilation and being intubated really does do a lot of deterioration to the body and makes it extremely weak. So some of the patients don't all go on the ventilation. They go into isolation, and their stays tend to be shorter, and they come out in a better state. So now we're kind of in the stage now of being discharged at home. And this is where we come in. So you can have a patient that's been recovering from being on ventilator, a patient who's recovering, who's was in the hospital, but not on a ventilator, but have experiencing many of the effects of it, or the patient, similar to me, who, were sick for three weeks with a high fever, chills, cough, tightness of the chest, and, you're kind of thinking, oh no, am I going to get through this night? Am I going to have to be admitted? That is, and then there's the different levels from there down, where people just have maybe a respiratory cough, and, they never really experienced the chest tightness or the shortness of breath. But still, the virus has a very strange way of working its way in and also affecting different people in different ways. So in your process of recovery, monitoring your body is very, very important. And when I say exercise is important, it is, but to just think that you're going to go back to what you did prior to, it doesn't work that way. I'm an old collegiate college runner who doesn't run nearly as much as I used to, but running 3, 4, 5 miles was not a problem. I couldn't even run for a minute. And that was just being sick for 3 weeks. And I tried, and I gradually built up. Now I'm getting back to where I can actually run half of Prospect Park, but it is amazing how much it does affect you. So I just want to caution you, this is not about getting back to your original program. This is about going into what we call the early recovery phase. Okay, so I'm going to go through this, and then we're going to have to give time for questions and answers. So this early recovery phase is just really what we want to just say to you in terms of how we would approach this. We're going to approach this through energy conservation techniques, which could be anywhere from pacing activities of your daily activities, home activity modifications, making sure you have the right assistive device if you are really at that point of being disabled. We would recommend and take you through a course of type of stress management. We have meditation classes that would be helpful for the connecting with the anxieties and the fears of being sick. So these are like calming practices to help kind of bring mind and body and calming the thoughts. We would attempt also to get you back on your sleeping cycles, to making recommendations so that you're sleeping on a normal cycle, which is very important. It's your sleeping cycle goes completely haywire when you're sick with COVID-19. We would introduce you breathing techniques, pressed lip breathing, diaphragmatic breathing. These are all techniques that we would help to just get the lung capacity to start to increase. But we don't want to force it. This is not the time to try to take deep breaths. This is the time to take, I would say, organized breaths and use exercises to help organize your respiratory, your breathing mechanism. We would direct you through your endurance training, which would start with basically, maybe for somebody walking in the house to walking outside for a block or two, and then gradually building that. We would also suggest and recommend to do bedside exercises, simple things as maybe sit to stand, knee extension and flexion exercises, ankle pumps, isometric exercises for muscle activation. There's many different active range of motion exercises that could be a starting point. If you're beyond that, well, then we can progress with a very light strengthening program that has a very high rep, low resistance program. We would introduce postural training because from the COVID-19, one of the things that at least personally I experienced and everyone else has experienced that I've talked to is the chest tightness. And it just doesn't release as you feel better. It actually persists. And so there's ways to help expand the musculature of the chest through the breathing exercises, but also through doing chest opening exercises and working on bringing the shoulders and the head, or the head, shoulders, hip in alignment. So you're really working on bringing the shoulders into proper position and expansion into the chest. Very important that for the people who are, if it's severe cases, fall prevention, we have to work and make sure that you're safe with your balance and assessing that and then giving safe balance exercises for patients that are in that process. And then the interesting thing is we're getting phone calls already about neurological management. And that means that because the patient is either bed rest, either in the hospital or at home, there's a pretty severe muscle wasting. So pretty much I lost, personally 15 pounds, and I did start losing pretty quickly muscle mass. And I've seen some stories where, bodybuilders who went from a lot of muscle mass to actually looking skinny. So the losing the muscle mass actually creates a problem with the peripheral nerves because the peripheral nerves now are more exposed, and they're more exposed with the chance of being more impinged. So I'm going to just go into this next phase because the next phase is really the reconditioning phase. It's the phase 2. And this is everything that I just said before now magnified to the next level. But for some patients, this next level needs to be supervised, or this level needs to, have some instructions how to progress. This is not the time to go back to your former program. You have to go back into a progressive step process. So this is same requirements, but at a more intensity. And I would still recommend with the strengthening, higher reps, low resistance. So during all this time, you do have to monitor your symptoms. Now, I kind of skipped it on the early stages, and I'm going to go back real quick. But if you have a change of blood pressure, or if you have pounding head or chest pains, or feelings of lightheadedness and dizziness, that could be a sign of a blood pressure change. If your increased symptoms of shortness of breath increases, you need to decrease your exercise. And if it persists, you need to call your doctor. If you notice heartbeat skipping or arrhythmias, you need to call your doctor. And if you start noticing that you're becoming more cognitively challenged and more confused, you need to call your doctor. Those are most critically important in the phase 1. Now in phase 2, it applies, but also, you have to realize that when you go for a heavy run or a heavy walk with a little light run, you are going to be out of breath and you are going to be breathing heavily. But you have to monitor that and just know that pushing yourself is good, but not to the point where it becomes, adverse to your well-being. So in conclusion, and we're going to skip the reconditioning phase here because this is what I just discussed. So in conclusion, the COVID-19 is a process of time, and it is a recovery. And what they're finding is the most important element is the consistency of effort with your home exercise program and keep moving. Listening to your body, and if you're unsure about your progress, seek guidance through your doctor. So thank you so much. This is my staff. I'm honored to have these as my employees. And we're going to have a question and answer period. And this is information you can contact us on. Heather?
Hi, everyone. So yeah, I just sent a message in that group chat. If anyone has any questions, I know that Elizabeth did have a question. She had asked, couldn't there be a correlation of people who are just more healthy have a capacity to walk more? You were talking, I guess it was around slide 5 when you were talking about that step ladder.
Yes. So I think what you mean is that if you already have a certain amount of conditioning, if I'm listening to this question correctly, everything is relative to you. There is no like standard. I mean, we put out a progress, but everyone is going to fit differently based on your level of severity of your symptoms. So obviously, if you've just been in the hospital for 30 days and you were in great shape prior to, you're still going to start at a very low level. But, you know, somebody who's maybe similar to me maybe come out of it and not have as much of an effect. But the most important thing is that you listen to your body as you go through getting yourself recovered. It would only take a couple of weeks if you were not hospitalized, you were in isolation and quarantine. Maybe it'll just take a couple of weeks to kind of get yourself back together. But they're finding that, well, truthfully, we're still learning and we don't really know the long-term effects of COVID-19. That's an unfortunate statement. And hopefully it's nothing permanent, but you know, we're going to find that out. And that's kind of what happens when a new disease comes into this world that we've never seen before.
Does anybody else have any questions that they would like to ask? You could just type it in the chat. We have about 2 more minutes left because we do have another open house right after this talking about the deconditioning and the active population. So does anyone have any questions before we end that they want to ask in the chat? Anyone? Everyone's good? Thumbs up.
All right.
Elizabeth had asked about blood clots. I just see blood clots prior to the, do you want to unmute your mic or so you can ask the question, Elizabeth?
Yeah, hi, can you hear me?
Yeah, we can hear you.
Thank you so much. So I've read and heard lots of anecdotal comments regarding COVID-19 patients getting blood clots. And I have been tested twice due to cardiac symptoms for blood clots. Both times were negative. The last test I had was a couple of weeks ago, and I've developed kind of a pinching. It's not a cramping, but a pinching feeling in one of my calves, which relieves when I sit down. And so I'm just concerned, like, should I be doing normal activity and stretching a calf if there is a potential for blood clots? I am taking a prophylactic baby aspirin every day with 500 milligrams vitamin C. I know you can't give medical advice, but
are you working with the doctor?
I am, but this calf pinching is new.
Okay.
So
well, I mean, what I said earlier, applies to every phase. Something comes up, you can't feel like, you know, I mean, I actually felt that way too. It's like, I don't want to call my doctor today because I'm sure I'm just going to bug him. He's going to tell me the same thing. But you know what? You can't think that way. If something comes up, now, clotting, you know, thrombosis is of the lower leg and that there are pretty clear signs and symptoms. So if you give him a call and you say, listen, I'm just concerned, he'll talk you through it. And then he'll actually could even evaluate, you know, the texture and not so much the texture, but the color of the skin and the swelling. And, you know, he can discuss what he or she wants to do with you in terms of the next step. So I think that's my best way of describing, you know, because again, I can't offer you medical advice and I don't want to tell you, but I think the most important thing is we all have to not be, you know, embarrassed or feeling like, oh, geez, you know, I can't keep stressing him out with my questions or putting undue burden. No, you need to, and we all need to. We need to use our medical system and use our doctors for guidance. So I would definitely do that.
Okay, thank you.
Great.
welcome.
And then we just have one more question and then we'll have to wrap it up. So Heather asked, with the shortness of breath with exercise, would you just decrease the walking, which has made more shortness of breath to shorter walks? What would you suggest?
Yeah, I mean, that's what I wanted to kind of, give my own personal experience with that. I mean, plus, we're going outside with the mask on. So you can imagine with the mask, you're just starting to, exercise. You're going to start to breathe heavily. Now, you have to be just a little bit self-aware to acknowledge, okay, yes, I'm breathing hard. Can I sustain this, or is it getting worse? And I think the breathing hard while you're exercising, if you can sustain it, then you can go a little further. But then if you feel like, oh man, this is getting really tough, then you need to back off and you start walking, or you find the intensity that you can manage. It's there is no answer that I can specifically give you to what to do, but you have to trust your own experience and trust your body. And I would really suggest don't listen to your head too much. If your body's saying no, stop. And no's are usually kind of one of those, all of a sudden the brake goes on and you don't even have a thought. You just stop. And you have to listen to that. So don't allow yourself to get caught up into the yeses and nos of going or not going. But if your body says stop, stop. And I mean, I did that, and I pushed myself probably a little bit more than I should have. And, not that I had any adverse effect from it afterwards, but I can feel like my body was saying, whoa, you're not back in college. You got to hold on and just, go easy. So I think that's the way you should approach it.